Hello and welcome to another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. There's an abundance of information that's available if you want to treat disease or if you have an ailment. But there really isn't a lot of great information that's out there to be able to find out what you can do for you and your family to help your body function at your best, resist disease, and be able to perform better throughout the course of your entire lifetime. That's the purpose of this program, the Wellness Spotlight. And I'm very honored to have as our guest today someone who is a lifelong resident of East Brunswick Township, someone that most people know, but I'm really happy that we were able to get him as a guest today. It's Dr. Michael Spadafino. Dr. Spadafino, Mike, welcome to the Wellness Spotlight.
Thank you for inviting me, Ken.
Mike, I know so many people know you around town, but for our viewers that are just meeting you for the first time today, why don't you tell us a little bit about yourself, your background, and some of the things that you've been doing?
Well, I'd be glad to. I'd like to actually kind of go back quite a ways so that people know really who I am and where I started here. Because I actually graduated from East Brunswick High School, I guess I'll have to say the year is 1967. And I played football here. I was on the track team. I did get a scholarship, went off to college. And
where'd you go undergrad?
I went to University of Northern Colorado on a football scholarship. And as I finished my undergraduate years, one of our football coaches here at East Brunswick High School, Mel Casero, called me and said, I need a football coach and we need a science teacher. And so I came, I interviewed for the job, and I got the job and began my teaching here in East Brunswick in 1974. And so I taught many sciences. I taught chemistry, I taught biology, meteorology, astronomy, the whole gamut. And I really enjoyed it. And I coached football and I coached track and worked with a lot of the old stalwarts of teaching in East Brunswick and coaching here. And I really enjoyed it. And as I came along, I actually met my now wife, Kathy. She was a vocal music teacher at the high school. And we hit it off and got married. And we started having a family. And having some old-fashioned values, we decided that while our children were young, that at least one of us was going to be home raising the children until they got to school. And so my wife took on that responsibility. She dropped out of teaching for a few years. And as our family grew, we had one daughter and then we had another. And as you can understand, back then especially, trying to raise a family on one teacher's salary was nearly impossible. She was taking on piano students, voice students privately. I was working odd jobs during the summer, which were really, I'm not going to say demeaning, but lower than where a college graduate should be. And so at a point I decided that maybe I needed to make a change in my life. And it's not because I didn't like teaching. I loved what I was doing, but I just didn't see how I was going to continue to raise my family. And so the part I wanted to say that was interesting is I went to Bob Sullivan, who was the guidance counselor, and he had just gotten this new Commodore 64 program that talked about and were able to figure out vocations. And so I went into that program and had put in all kinds of information about what I liked, my education and things. And what he came up with was 10 on the list. And one of the things was teacher, medical doctor, forest ranger. And on that list was chiropractor. I knew a couple of chiropractors, but I'd never been to a chiropractor. So I called up one of my friends and I said, tell me about this chiropractic. I mean, you've been a chiropractor a few years. What's it all about? So he said, come to my office and let's talk. So I went to his office, and being a biology teacher, he said, the premise is pretty simple, Mike. He said, what you have is a situation where you understand that the nerves that go to the body primarily come out of the spine. If there's nerve interference at the spine, it's going to affect where that nerve goes in the body. And he says, chiropractors relieve that pressure off the nerve. The body will heal itself naturally. I thought about that and I said, wow, that makes a lot of sense. I said, I want to be part of that movement. No drugs, no surgery, just a natural healing art. And so after that, I researched, went to my wife, we decided to go. I left teaching to go to chiropractic school. I came back out of chiropractic school. I was thinking about several states to go to. My wife said, I want to go to East Brunswick. And I said, not Colorado, not California. She said, East Brunswick. So we came back and I set up practice here in East Brunswick. And as a matter of fact, I don't know if you maybe remember, but when I was looking for understanding of where and how I should open a practice, you were the only chiropractor in the area that welcomed me and met with me and said, all right, this is how you do it if you're going to open your own practice. And I thank you for that, for leading me in the right direction, even though you knew I'd be in the same town. I appreciate that, Ken.
Yeah, oh, you're very welcome, Mike. It's been my pleasure. Mike, it's interesting. You know, you would think that a guy who has a background in athletics like you would have gone to a chiropractor himself, but you found out about it just as being one of the top 10 professions. Mm-hmm. How has it lived up to your expectations? And you know, what are some areas where you felt the greatest surprises from your preconceived notions?
Well, what I thought of initially was that because of, even though philosophically I had a broader spectrum of what chiropractic is and what it can do and what it means to health, I still came out with a mindset that was more directed towards pain relief and pain management. And, you know, because I was involved in athletics, I took some special courses, got certified as a chiropractic sports physician, and so my leaning was towards injuries. And so initially I started to working on more people with athletic injuries amongst my other patient population. And after a while I started to realize that, wait a minute, I'm only solving half the picture. The other half of the picture is once a person doesn't have any pain and is feeling healthy, are they really healthy? And there were so many people that just said, you know what, I want to continue coming because I just feel better when I get adjusted once in a while. And I said, and all of a sudden that light bulb went on in my head and said, wait a minute, this is really what I was initially taught about what chiropractic can do, is not just solve your pain problem, but actually keep you healthy. And so since then, I've tried to move my practice more towards a healthy wellness, lifestyle, long life, full life type of practice.
You know, it's true, Mike. It seems like years ago, when we first opened up, the general idea about what being healthy and wellness is not sick.
Right.
You know, as long as you didn't have any symptoms, then you were healthy. And the whole goal of the care that you got was to be able to make the symptoms go away and be able to feel good again. And drugs are a very effective way of being able to do that fast and inexpensively. But we all know, especially these days, with all the research that's coming out and the horror stories that we hear, right, that while they may control symptoms, it really doesn't help a person become healthier again. And that opens up a whole different world of opportunity in being able to follow different activities as part of a healthier lifestyle.
Right. I still remember one of my very early advertisements that I had put on a radio spot. I think it was for Rutgers basketball, where essentially the premise of it is, if your engine is running and sputtering, do you put a piece of tape over the gauge that says that you're having a problem and go on, or do you try to take it to somebody who can fix the problem so that that idiot light goes out that says you have a problem? And that's kind of the idea, is that using drugs most of the time is not corrective. All it does is mask the problem, and if you stop taking the drugs, you've not gotten to the source of the problem. All of the problem will return.
And now there's people at home going, yeah, those chiropractors, they all hate drugs. You know, they're anti-medicine. And that's not what it's really all about at all.
Not at all, not at all. The idea is no, I mean, I'm not going to tell you that, you know, if you're diabetic, that you should stop taking insulin because you're under chiropractic care. What I want to do is try to help you have a healthier lifestyle so that maybe at some point you can discuss the possibility, especially if you're a type 2 diabetic, that maybe you don't need that. Maybe you don't have to do that. We see this all the time now. I was watching The Biggest Loser last night. Woman loses 75 pounds. All of a sudden, the doctor checks and says, you know what? You're no longer a type 2 diabetic. You are now healthy enough that you don't have to consider that as part of your problems.
So essentially what you're saying is that regardless of what a person may or may not do with respect to drugs, you're going to be healthier and better off if the energy that's flowing over your nervous system is permitted to flow without any interference to the process from a correctly aligned spine.
Right. That's right. And all the time, more and more studies are coming out that demonstrate just that if you are healthy as far as your nervous system goes, that leads to better health overall because you are more in tune with your body. And I also hear that all the time with my patients that say that after they've been worked on and their spine has been corrected for a period of time, they're the ones that turn around and say, you know something, I am more in tune with my body. I hear what my body is saying much better. And so they know that there are things actions that they have to take to make themselves even healthier.
Mike, why do you think it is then that more medical doctors don't refer their patients to chiropractors the same way that chiropractors refer their patients to medical doctors for diseases and other problems that require medical intervention?
Well, it's a two-pronged problem, I believe. One is an old concept that's been drummed into medicine that there is no foundation for what chiropractors do. There's no proof, and there's abundance of proof. But of course, they're not reading it because it's not proposed to them in medical school. Because just like our focus in school was toward the spine, their focus is away from our spinal activities and more towards the medical, drug surgery situation and how they can be intervening on behalf of the patient. So when we try to check our premise with them, it's not in the vernacular to be able to really identify with that. So they either poo-poo it or they've been told that what we do is not effective. And so it's actually almost kind of a lack of education on their part that they really don't know what we do. I have a few medical doctors in this area in East Brunswick that regularly send me patients because they understand it. They understand what we do, that I'm not competing with them, that the premise of what I'm trying to accomplish with my patients does not interfere with what they're trying to accomplish with that same patient. So I do have some medical doctors in town that actually refer to me pretty regularly.
Yes, and you would think that there would be many, many more too. What do you think would be the message that as a profession chiropractors could put out to be able to show the allopathic community that we're here to be able to help them get better results for their patients and participate together for everybody's better health and wellness?
Well, the gap in that is getting much easier to cross because when you turn around and you look at Robert Wood Johnson now has a health and wellness center in the hospital where you can go, you can work out in New Brunswick, and they're beginning to say, oh, well, you know what? You want to be healthier. A healthy lifestyle can help you be healthier, and you don't necessarily need as much medical intervention if you do those things. What we have to do is make a transition so that the medical doctors at large understand that we've had that premise since 1895. All along, our premise has been about wellness and health, and that we just need to help them understand that the integration of a healthy spinal and nervous system on a daily basis enables those other factors of diet, exercise, having a good psychological outlook on life are all the factors that pull us together and make us one, not in competition, but that our goal is to have the population be healthy.
So for our viewers that are out there, Mike, that have never had any experience with chiropractic care before, they're probably wondering at this point, how does going to a chiropractor actually help your body be healthier?
Well, one of the things that we are in our office, and I know in your office also, that we have moved into a higher level of technology. We have a mechanism, an instrument panel that does several parameters of health, and mainly it's measuring spinal activity and how that activity is demonstrating itself in your body. And with that instrument, we're able to locate areas of problem, also not only in your spine, but also in your lifestyles that are indicated from this testing. So it's not, just go in and touch and feel somebody's spine anymore. It's actually high-tech information that tells us what we can find out about a person's life and their lifestyle and whether they need chiropractic care and how much. So what I would say to a person is that they should come get their spine checked, get this instrument to take a look at their body and be able to report to them what it's telling us about their life and their lifestyle that can indicate what they need. And of course, let's not leave out that, if there's an indication, back to the basics, if you need an x-ray so we can look at what the structure of your spine is, that is absolutely an integral part. I mean, even myself, having never been to a chiropractor, I went, and when my friend x-rayed me, I found out I had an extra bone in my back. And he said, you played football all these years. He says, if they'd have known that you had that bone in your back, you might not have been allowed to play. It's like, I'm glad I didn't find out.
Thanks for telling me now. So the technology gives us the ability to be able to have an expanded clinical vista. In medicine, the ability to be able to have new technology, to be able to non-invasively evaluate someone and be able to gain better insight as to how their body's working, gives the doctor the ability to be able to make better recommendations on whether or not they need care, and if they do, what's necessary and appropriate. And this technology, I think, is great because it can be used on someone with absolutely no symptoms. And that way, you could be able to find out whether or not they may have an impending problem and be able to guide them appropriately so it doesn't cost them loss of lifestyle or their health or a lot of money later on to try and treat it. Why don't you talk a little bit about the difference between being proactive and reactive?
Well, being proactive is a choice to make. Like, at some point, you have to make decisions for your life. And a reaction would be where something happens to you, such as you become so obese that you get a diagnosis of type 2 diabetes, and then somebody says, you either have a choice. You can either go on insulin or you can lose 50 pounds. A proactive choice would be, gee, I'm starting to gain weight. Maybe I should do some things. Maybe I should exercise. Maybe I should, take a look at my lifestyle. Or one of the other things I find that over and over again is the stress level that we all are under nowadays, because we have this media bombardment of negativity. We find ourselves worrying about everything. When the hurricane was coming, we knew it was going to beat us up a week before, and everybody was all upset and worried about it. And those stresses, all occur. But if you prepared for the hurricane, you had a generator, you bought gasoline, you boarded up your windows, and prepared for a flood, then when the action happened, you were proactive, you were prepared. Instead of reacting, my lights went out, now I got to find gas. Now I got to find the generator. Now I got to see if my basement's flooding. The same thing happens in lifestyles. You can either prepare and do what you can to be as healthy as possible, which in our case, we believe having chiropractic and spinal health is a part of that picture, or you can wait until you have a pain, you have an ache, you have a crash in your lifestyle because of your stress. Then you have to react and try to dig your way out of a hole.
Mike, take a couple of minutes and talk about what most patients experience when they come into your office, starting from the very beginning.
Well, when somebody comes into our office, it's a standard procedure as you would go to any health care provider. You fill out a health history, information, confidential information about why you're here, but also your history of what your background you take, what medications you take. And after that, we use the subluxation station, the instrument, to check that is a basic part of our examination to see where the stresses are, other than necessarily when you're coming in saying, I have a pain here, So we also take a look at that whole thing so we can give you a full picture of the dynamics of what's going on in your body. And then we also do basic examination to try to bring out the characteristics of what is actually brought you into the office if it's not just for health. And then, if necessary, if it's called for, we'll take our x-rays, be able to pull together a full evaluation. If a person's in a great deal of pain, we'll do some preliminary treatment to try to at least give them some relief. And then we'll arrange for reported findings where they come in. We give them our recommendations when we tell them what's their problem and whether I can help them or not. Because if I don't think I can help them, or I think they need co-management with chiropractic and their medical doctor, I'll tell them that too.
Mike, the patients that you accept for care, these are all people who suffer from misalignment of the spine. The clinical term that as chiropractors we use is the vertebral subluxation complex, or what we call subluxations. Areas of the spine that have misaligned, pinching the nerves and interfering with the flow of energy between the brain and the body and impairing the body's ability to be able to heal itself and function well. What types of patients do you tend to attract typically in your practice?
Well, because of the fact that we are working with many insurance companies still, that the greater majority are people that come in initially with pain. I do have a long history here in town, so I do get a lot of referrals internally, and those patients are more likely to be of the type that are guided by a more healthier desire, or desire to be healthier overall, because they know
that proactive approach,
because they know that we offer the instrumentation and the background to be able to do that. I even have the instrumentation that now I have bought into, one that does a total health evaluation, body mass index, heart rate variability. It measures your blood pressure and your weight, and it pulls together and actually gives you a full body health score to be able to say, these are the factors that in your life that have actually been measured now, just not dealing with the spinal situation, but your whole health situation, and offers the probability of your being healthier by, eat fit, exercise, and get a healthy mindset along with chiropractic care to be able to bring together a full, whole, healthy lifestyle. And that's what I try to move my patients toward that.
So, Mike, we've talked a lot about some of the politics of healthcare and about the analysis that chiropractors do to be able to determine whether or not a patient may need care. Let's spend a little bit of time talking about the essence of what we do, what a chiropractor does to actually be able to help a patient. Can you talk a little bit about that in your office?
Well, in my office, a lot of people don't understand about the chiropractic adjustment. What we do is when we locate that subluxation or that nerve pressure, we utilize, mostly chiropractors use hands to be able to alleviate that nerve pressure and relieve that subluxation. So again, that body will start that healing process. How depth of the problem determines how long that's going to take. In some cases, getting out of pain can be very rapid. Sometimes it takes time because you've had the problem a long time and now you've blown the doors off and it's going to take time to get better. There's a lot of ways to do a chiropractic adjustment. There are some that are more aggressive, more forceful, which bring about a very rapid change, and it's very effective. And then there are other techniques that are much more gentle, right down to very light force adjusting. They're all effective, but I believe that the chiropractors have the knowledge to be able to determine which method is best for which patient. So it's not like a one-way fits all. We've been taught many tools in chiropractic to be able to help a person remove a subluxation or get nerve pressure off. The things that we do, I've adjusted infants, babies, you can say, from a couple of days old, and my oldest patient was 98 years old. Now, how I adjusted those patients is very different from how I adjusted an athlete who was 19 years old. So what we use in the gamut of technique is very wide ranged, actually.
Mike, in addition to being involved on the Township's Advisory Health Council, I know that you're also very proactive within the chiropractic profession. You know, you have been a leader within the chiropractic profession. Talk a little bit about that and your present role on the State Board of Chiropractic Examiners.
Okay. In 1997, I got onto the board of a chiropractic organization in the state called the New Jersey Chiropractic Society. Within a year, I got elevated. I think it's one of those where, well, somebody step forward to volunteer and everybody step backwards. Next thing I knew, the next year I was the president of the New Jersey Chiropractic Society. And what we did is as a society, is we tried to help support fellow chiropractors to be able to have them make them have a better practice, to be able to help them deal with issues, and also to be able to have to go about dealing with legislative issues in the state. And
continuing education, so doctors are on the cutting edge of being able to provide the best information. And now it's one of the biggest organizations in the country, isn't it?
Right, because, well, at the time, very strangely, all the counties in the state, can you believe how many counties there are, had their own little chiropractic organization under their own little umbrella. And I made it my personal crusade to get all of those chiropractic organizations under one roof for many reasons, because when you try to be proactive in the state, legislatively, et cetera, you have to have numbers, you have to have power.
And now you're on the State Board of Chiropractic Examiners, so you actually oversee the licensure and disciplining of chiropractors throughout the state.
Right, because chiropractic actually has evolved. We were working under a 1950 statutes all the way until just 3 years ago, when by strength of the chiropractic organization, we were able to enable a legislative change which allowed chiropractors to do what we've been taught in school for years. It's almost crazy that in the state of New Jersey, we came out of chiropractic school with a whole bag of information that they said, in the state of New Jersey, you can't do any of that. And so we finally opened up the doors to be able to do a better job of diagnosing and dealing, and actually made it so that we have a better conduit with medical doctors to be able to refer better, because we have the ability to gain the information that helps us better know when we should be making a referral to a medical doctor and not just keeping the patient to ourselves, that we should be able to give better health advice and be able to give the patient what they need in order to be healthier. So being on the chiropractic board now puts me at the next level, where the chiropractors' problems, whether they would need to know, what can I do in the state? And so by knowing all the rules and regulations that guide us, we tell them what they can or can't do. When a doctor makes an error, we have to sanction them. We do what we need to do. And overall, we try to make it that as a patient advocacy group, that we protect the public and that we make sure that the chiropractor is able to perform the duties that he's been trained to do.
Thank you, Mike.
My pleasure, Ken. Thank you very much.
I'm Dr. Ken Friedman, president of the East Brunswick Advisory Health Council, with my colleague, Dr. Mike Spadafino, reminding you that wellness works when you work it.